Hello, I'm Dr. Frances Pitsilis, and welcome to the Well Woman podcast with me, Dr. Frances Pitsilis. I am a medical doctor, author of the best-selling book Well Woman, which is currently available in Australia and New Zealand, and hopefully in other countries later. I've spent many years researching and treating patients with difficult and chronic diseases, along with around 20 years of discussing health on radio, TV, and print media in New Zealand. I've practiced medicine for 45 years now, having trained originally in Australia and later trained in family medicine in New Zealand. I'm also trained in nutrition, hormones, occupational medicine, which is about work-related problems, and I'm board certified in the USA in anti-aging and regenerative medicine. I also have a diploma in obstetrics and gynecology, but I'm not a specialist in that area. The beginning of my professional life was as a family doctor, and I practiced in suburban Auckland, where I saw all ages of patients, including maternity care, delivering babies, as well as end-of-life care. I now practice medicine that you might call holistic or complementary and alternative medicine, or precision medicine, or functional medicine, depending on which country you're in. Be assured that I combine my traditional training with research-based treatments that include diet, lifestyle, hormone therapy, and nutraceuticals or natural supplements, including vitamins, fish oil, and plant-based supplements. In 2011, I made a television series here in New Zealand called Is Modern Medicine Killing You?, where I helped all my patients get well that had not been helped by several doctors. And this series was highly popular and won the television ratings. So that you have an idea of my experience and knowledge, the problems I've been seeing in my clinic here on the North Shore of Auckland for the past 26 years as a second opinion doctor are broad and have included many conditions, including acne in young people and adults, eczema, psoriasis, rosacea, asthma, hay fever, sinus problems, mast cell-related conditions and mast cell activation syndrome, irritable bowel syndrome, many autoimmune conditions, including lupus, SLE, rheumatoid arthritis, multiple sclerosis, celiac disease, the inflammatory bowel diseases like Crohn's disease and ulcerative colitis. I've seen patients with heart disease, blood pressure, heart failure, type 1 and type 2 diabetes, obesity and weight problems, osteoporosis, osteoarthritis. Now, the hormone problems I see include polycystic ovarian syndrome, premenstrual syndrome, heavy or painful periods, menopause and hormone problems in men and women, endometriosis, thyroid problems, erectile dysfunction, pelvic floor weakness and bladder or bowel weakness issues, chronic fatigue and chronic pain conditions, including fibromyalgia, migraine, headache, and sometimes I use botulinum toxin for them, stress, depression, anxiety, burnout, sleep problems, and memory problems. I work as a second opinion doctor seeing men and women, but mostly women, as they seem to suffer more with these health problems. During these podcasts, I'd like to outline some of the underarching themes that contribute to many of the difficult problems I see. And I want to bring this out in the podcast so that you can understand how to help yourself. This podcast has been created because women's health around the midlife and all around it is still too often misunderstood, rushed, or simplified, especially in the areas of hormones. I want to get the information out there to as many women as possible. In these podcasts, I will be speaking directly to you about topics I think are relevant. I will also have everyday as well as well-known people, and eventually I hope to have expert guests on the podcast. Now, women also look after their men, so at times I will cover topics that both affect men and women, or even just men alone, because women tend to be the centre of care for everyone. These will be thoughtful, practical, and hopeful conversations, grounded in science, experience, and respect for women's realities. Whether you're navigating change yourself, supporting someone you love, or simply want clear, trustworthy information, you are very welcome here. I don't need to expand my practice. I'm actually very busy, and I practice only in New Zealand. Rather, I'm doing this to spread the word to more people, especially women, about good health. I cannot give any personal advice, but you can ask for particular topics on my YouTube channel, which will then give you insights into how I treat that condition when I cover it on the podcast. Of course, this podcast is designed for general educational purposes only and does not replace personalized medical advice. Always consult your own healthcare professional regarding individual concerns. I will be creating podcasts and stocking them up so that you can look forward to perhaps one every 2 weeks to start. I look forward to seeing you again soon at the Well Woman podcast. Goodbye for now.